now. Let's take you to KZN now. South Africa has just one doctor for every 3,000 patients. The South African Medical Association trade union says this is happening while qualified doctors remain unemployed. Now it's marching in that province today to demand public sector jobs for doctors who have done their community service. That's where we find eNCA's Nqobile Madlala. She joins us from Durban in particular. Nqobile, quite alarming statistics when you look at the ratio, one doctor to 3,000 patients in South Africa. What are those doctors telling you in terms of what happens when they try to apply for positions?
Well, Masako, from what we have heard from the doctors who have spoken to us so far, they're saying that it's very difficult to work under these conditions, and they're saying that they see the need for government to be able to get other doctors employed into the government so that they're able to get more assistance. But of course, they are going to send that memorandum, which will then determine whether they go forward and plan more marches to ensure that they can speak more about these issues or not. But I want to bring in right now some of the leaders that have decided to join and in solidarity sort of echo those sentiments with some of these doctors. Zulu, what makes you decide to be part of this struggle?
Thank you very much for the opportunity. We are here as the Young Communist League in Moses Mabhida province in KwaZulu-Natal to stand in solidarity with the unemployed doctors. These are the members, they are part of the working class in our province, and we are saying that all the issues that they have put on their memorandum that talks to issues of being unemployed, and those who are employed are talking about terrible conditions of service. So those are the issues to us that are fundamentally important, and we are saying that we need to work to come close to them and understand better what are the issues and then rally behind them in support of them being addressed by our Department of Health and by government as a whole. So that's why we are here.
And I mean, as a youth, you would understand very well how much unemployment affects each and every family, because we get to see people that we know who are also unemployed. Why is this important then to get these doctors employment? Oh,
absolutely. The issue of unemployment is a function of the economy and how it is not, it is reproducing inequality and all of the negatives. But to come closer to the issue affecting the doctors, it's about the bread and butter issues. They have been through the academic system being supported in studying in universities, and they've completed their qualifications. And what the next thing that follows is the issue of employment. They need to be absorbed into the system. They need employment, given a chance, given an opportunity to say the skills that they have, the knowledge that they would have acquired as part of their qualifications, they need to put them into use. In a country like South Africa, we have the huge burden of disease. Challenges around our healthcare system, all of us, we are aware of them. So we need to get the human resource that our country needs to assist our communities to deal with the issue of health and reducing the burden of disease in our country. So they are a critical component of that. You cannot move forward, you cannot improve the healthcare system and the healthcare sector in South Africa without this critical mass of people that are going to come into the system and help stabilize it in many ways. So that's why we support them. We understand the frustration of being unemployed. We understand the need for them to be in the system so that they can work and improve the quality of lives of our people.
And of course, you come from the political side. You would then understand how communities much need this kind of assistance. But is there a way that you can echo these sentiments somewhere in Parliament, maybe?
First of all, we are not in Parliament, and we are here with them on the ground in solidarity with them to understand their issues. But obviously for those comrades, our leaders that are in that space, we will definitely take the memorandum to the Department of Health, to the Premier's office, even to Parliament to say, can you not get closer to the issue? The Portfolio Committee of Health must get closer to the Department of Health to say what are the issues in terms of prioritizing the issue of employment of medical professionals. So we will take that up definitely when we continue our interaction with our comrades here, the unemployed doctors.
And I understand that you said that there is also a plan of movements that you guys are planning, perhaps with regards to marches and so on. Is there something like that?
Oh yes, absolutely. It's not just a one-day activity. We are guided by them, by the doctors, and we're working together with them to come up with a program. And today is the first of rolling mass action to say we cannot allow a situation where we can have one doctor who's qualified, who's sitting at home, and we have these challenges that we have. We are saying those that are in power, they must not sit in air-conditioned offices and not prioritize the issue of doctors and nurses and everybody. We have people from laboratory services that have many issues, even last year, that they were not being attended to. So we are saying we need to get close to these colleagues that are in the healthcare sector, because clearly there are a lot of challenges. And we are saying those comrades that are leading, they must lead and take decisions that are going to improve the lives of our people.
Well, Masego, as you can hear there, they're saying that they will stop at no way to make sure that they are going to echo those sentiments. I want to show you, those are some of the doctors that you see behind me. Some of them are also nurses that are coming in to assist and sort of echo the sentiments of the people that they work with. But we do understand that more people are yet expected to come through. And as a result, we have already seen the police ensuring that they are going to be here to assist with the march and so on. But we do know, from what we have spoken to the leaders, they said that the great risk of having some of these doctors being overworked and being overburdened with so much and not getting other people to come into the system is that you start to see mistakes, and human error can be very, very dire at this point. So we do need more of those doctors to come in and talk about their experiences, but we are going to be getting it as they do the marches.